During pregnancy ultrasound, the most interesting question we are expecting is, "Hi doc, it's a baby girl or baby boy?" And suppose I say it's a baby girl. And the next most dangerous question is, "Hi doc, how confident are you that it's a baby girl?" So in this video I will explain you that for a sonographer or for a radiologist, how difficult and how complicated it is to tell you accurately whether it's a baby girl or baby boy. So the most important point you need to understand is that before 14 weeks of gestation, or in simple words, before 14 weeks of pregnancy, your doctor or sonographer cannot tell you accurately whether it's a baby girl or baby boy. But at 14 weeks or after 14 weeks, your sonographer or radiologist can give you a reliable information about the gender of your baby. So as the age of the pregnancy increases, the accuracy of gender determination increases. But an experienced sonographer or radiologist is able to tell you the accurate gender of your baby at 14 weeks of gestation. So the other most important point you need to understand is that the doctors or sonographers determine the gender of your baby by viewing the genitals or sex organs of your baby. So before 14 weeks, these organs are not fully developed, so they are unable to tell you whether it's a baby girl or baby boy. And after 14 weeks, the accuracy of predicting or accuracy of telling that it's a baby boy is more than telling you about baby girl. So the message is, at 14 weeks or after 14 weeks, your sonographer can tell you the gender of your baby, and after 14 weeks the accuracy of gender determination increases with the age of the pregnancy, and the accuracy of male gender determination is always greater than female gender determination. I hope these points will help you to question your sonographer or radiologist more sensibly and more accurately.